Welcome back. It's true that being black in America is hazardous to your health. African Americans have higher rates of diseases like HIV/AIDS, hypertension, and diabetes, and are more likely to die from violence and have less access to quality health care. Yet there's another shocking stat that doesn't get much attention. For every 1,000 children born to black mothers, 13 of them will die before their first birthday. That's an infant mortality rate of 13.1 per 1,000 live births. And that's according to the Center for Disease Control and Prevention in Atlanta. And it's more than twice the rate of white American women at 5.6 per 1,000, and higher than the rate of countries like Portugal at 3 per 1,000, Croatia at 4 per 1,000, or Romania at 11 per 1,000. Some of the causes seem predictable. Compared to whites, black women in America get lower quality medical care, especially if they're poor or lack full service health insurance. Other factors are obesity, smoking, or poor nutrition during pregnancy. But several studies over the last decade show that the 13.1 infant mortality rate is about the same for healthy, affluent black women with college degrees. Age isn't a factor either. Black mothers across the range of childbearing years are losing their babies at a double-digit rate. Doctors now point the finger at the chief culprit: racism. Yes, racism. In a 2007 study, researchers in Chicago compared infant birth weights of babies. Low birth weight is a key indicator of infant mortality and a newborn's health. Infants born to white women had an average birth weight of 7.5 pounds. Infants born to African and Caribbean immigrants new to the United States had an average birth weight of 7.3 pounds. So the average birth weight of babies in the two groups were nearly identical. But the same study found that babies born to the next generation, the daughters of black immigrants, had dropped to the same average weight as African American children, about 6.8 pounds, almost a full pound lighter than white babies. Doctors, at a loss for a scientific explanation, now believe the everyday stress of being a black woman in a mostly white society is the cause. One researcher said constantly dealing with racism is like revving a car's engine without easing up on the gas. The stress takes its toll in the lives of unborn children. Joining us today to take a deeper look at the alarming infant mortality rate in the black community and to identify solutions to bring down the rate are two specialists in the field. Dr. Nadine Gracia, Acting Director of the Office of Minority Health at the Office of Health and Human Services, and Dr. Michael Young, a neonatologist and chairman of the Department of Pediatrics at Howard University Hospital. Folks, welcome to the show.
Thank you.
So somebody watching may say, give me a break. Can you really believe racism is a reason behind it? But there really is no other rationale to explain this.
Well, and I think one of the important things to think about is when we define health, and the World Health Organization defines health as a complete state of physical, mental, and social well-being. So recognizing that physical factors are important, but also that social well-being and thinking about psychological stress and social stress can also be important factors that influence our health.
Those stresses also of racism can be translated into poor behavior, so that you will see more smoking, and you will see poor diet choices, and you will see lifestyle changes that can affect the unborn child.
And when we talk about racism, I mean, obviously we're talking about when you're on, even in the workforce, in terms of the things that you have to go through dealing with supervisors and dealing with folks very well might be, questioning your own particular work, things along those lines. And then outside of that, just whether or not you're driving down the street, cop pulls up behind you, you automatically tense up, checking, okay, do I have my driver's license, my insurance, all of those sort of different things. Is that what we're really talking about here?
Well, I think it's a multitude of factors, and certainly when we think about health, and to Dr. Young's point about how that type of social stress can also lead to unhealthy behaviors, it's really how we certainly at the Department of Health and Human Services really thinking about how you transform health and health care. And certainly we have no better platform for that than the President's leadership through the signing of the Affordable Care Act, which is helping us to provide better access to care, but also improving the quality of health care that women receive.
What jumped out at me was the fact that even if you are a college-educated black woman, you have the same issues.
You do, but you have to remember that that college-educated black woman may be the first college-educated black woman in her family. So she's stepping out from a set of circumstances that while she has that education, she has the habits of the home that she came out of. And so that just economic is not enough. And even with the college education, we still are not, in spite of the Ledbetter rule, we're still not paid the same. And so you have households that have same kind of financial stresses. And so an economic plus does not always translate into a better circumstances necessarily.
So even those individuals, they've had the cultural influences for so many years as still impacting them.
Well, and another thing that we see too is that women, you know, still, even though they are the primary caregivers in their families and they're connecting all of their, you know, their children and their husbands and spouses to care, they often are the last to seek care. And so we also see, for example, that African American women, they still have higher rates of either not having prenatal care or getting prenatal care in the third trimester, not getting access to preventive screenings that can actually lead to healthy pregnancies. And so that again is where the healthcare law plays such an important role to really improve the quality of health care and the access to health care.
So how do we actually change this then? Because obviously, even if that child doesn't die, that child is still impacted later in life. Jeffrey Canada said when it comes to the state of black children in education, we've got to go back to the womb. He said black children are behind, even in the womb, behind white children. So how do we change it? Where do we start? What do we do?
Well, preconceptional health is actually important. When we say preconceptional, that's women who, before they get pregnant, before they even think about getting pregnant, improving their diet, their exercise, their lifestyle is a big piece. Because most pregnancies, even in marriage settings, are unplanned. And so if you have not taken care of your health prior to that point, then you've got some catching up to do. And in an unplanned circumstances, sometimes people delay getting into the healthcare system. And if they happen to also be encumbered by poverty, then some systems don't even allow them to until they come to viability, almost 20 weeks before they can say, I'm going to get Medicaid or Medicare to help them. So that there are a lot of little pieces that fall in that can deter the appropriate care for mothers and babies.
And one of the things that our office, the Office of Minority Health, has launched is a campaign to promote awareness about infant mortality in the African American community. It's called A Healthy Baby Begins With You. And our campaign spokeswoman is actually Tanya Lewis-Lee, who goes around the country really educating communities about infant mortality and the importance of preconception health. And partnering with that, we have the Preconception Peer Educators Program, where we actually train and teach college students about the importance of preconception health, as well as accessing care, and then they serve as trainers in their own communities, not only on college campuses, but also in the communities where those campuses are located. And we've trained over 1,000 students to be those preconception peer educators.
All right, well, Shirley, thanks for all the knowledge and information, and hopefully it will take root and we can change those numbers. I appreciate it. Thanks so much.